Hi friends, I am Anjali from Door to Care. Today we are talking about diabetes mellitus. Today we have Ali sir who is diabetes educator and he is going to tell you about diabetes.
It's the safest medication in diabetes just because insulin is a peptide hormone and it's a natural hormone which is produced by pancreas in human body, so it has no side effect. Insulin, if we talk about insulin is even safer in GDM, gestational diabetes mellitus, and even in pregnancy and lactation. So you can feel that how safe this medication is. Generally, patients ask me that if we take insulin, then we will have to take the insulin for the whole life. So it's not true. Doctor can prescribe insulin for a short period of time or for the time being. As soon as your condition improves or your blood glucose levels are normal, insulin can be stopped. But most of the times insulin are prescribed for a longer time or long duration, or sometimes for the whole life. Insulin is the safest medication even for the cardiac patients, for renal patients, or in sick days when the patient is going for a surgery, or even in when a patient has a severe injury. So that time insulin is the safest medication. If we talk about the effectiveness of this medicine, it is given 7 stars. If we talk about the mode of consumption, you all know that insulin is injectable, so it's injectable therapy. You will have to take injections of insulin, but generally these days the work is there is projects are going on oral insulin, so and the trial are in phase 2. So I hope that soon we will be able to consume insulin orally, and there will be pills or tablets of insulin hormone. If we talk about the hypoglycemia, so of course insulin can cause low blood sugars and it can cause hypoglycemia. If we talk about the weight, yes, insulin causes weight gain. If we talk about the effect on kidneys, it is safe for renal patients. If we talk about the effect on heart, so it is safe for heart patients also. If we talk about the monthly cost of this therapy, so it's not very costly. Sometimes rupees 1 to 3 units of insulin, rupees 1 to 3 per unit insulin can be the cost of this therapy. But sometimes there are some brands which manufacture insulin at a very high quality, so about 300 to 3000 rupees per month is just the cost of insulin therapy. And if we talk about the side effects, so hypoglycemia is the only side effect of insulin, and sometimes the injection site reactions are there, or lipohypertrophy, just because of ignorance. So these are the side effects, but there is no major side effect of insulin, and insulin is the quite beneficial, and insulin is the only treatment in type 1 diabetes, or latent autoimmune diabetes, or in gestational diabetes if metformin is intolerance is there. But in type 2, in later stages of type 2, when there is no production of insulin by pancreas, insulin is the only treatment, but it is the safest treatment in diabetes care. So thank you so much.